Lovely. Thank you so much for joining me, guys. I can see that you're interested in the topic, so we're going to jump into it very, very quickly. Before I do that, a quick intro. My name is Dr. Sylvia. If you've not met before, I'm a general practitioner with a special interest in women's health and sexual and reproductive health. And so I discuss everything around that. You're so much welcome. I give a disclaimer that we do not provide medical advice or treatment on the channel because we simply can't. Since we're doing this online, I don't know you. I don't know your medical background. So much I don't know. So I just can't provide that advice and treatment. What I can do, though, is help to educate you, help to tell you what symptoms mean or what conditions mean, help to demystify any jargon, and then suggest what you can say or the kind of conversation you can have with your own doctor who knows you and can provide the treatment that you need. So let us get that out of the way. This is a very interesting comment that we're addressing from the mailbag today. Let me read it out to you exactly the way it came. It says, "Ma'am, please help me to deal with cervical erosion," with a crying emoji. So when I first saw this, my mind was like, wow, what's going on? I always think if one person is asking this question, I'm sure somebody else is wandering around it. So let us talk about cervical erosion. If you have heard of cervical erosion, then please put a comment, put your hand up or something in the comment section. Whether you're watching the replay or watching live, let me know. But let's talk about it. Now, if you're like me and you heard the word erosion, you'll be thinking, right, what on earth has erosion, movement of soil? Think back to those days when they taught us geography and we were talking about water erosion and wind erosion, of those things, and like what is moving away? Is my cervix gradually moving away? No, that's not what's going on. And in fact, that word cervical erosion that term is an old one and really probably doesn't explain what's going on, and it sounds quite frightening. But let me explain what's happening when they say cervical erosion. So first, we're referring to the cervix. The cervix is the neck of the womb, or the first part of the womb. But when we talk about erosion, I want to describe what is happening. And the best way I think that you understand is if you consider your lip. Yes, your lip, that projection from your mouth. Now, if I ask you to feel your outer lip, you can feel it's a different texture to the inner lip. If I said to you, run your tongue inside your lip, you can feel that the inner lip feels smooth, it's sort of fleshy, it sort of feels more fragile compared to the outer lip where we all apply our lipsticks and our balm and what we can see. There's a reason for that, okay? The inner lip is in there, inside your mouth. It's got, like I said, it's more fragile, more fleshy, a lot more blood supplied to it. And it also has cells that are make fluid or make substances that your body, the inside of your mouth, needs for its activity. Different from the outer lip, where it's more of a protective job or protective function that it has. So it's exposed to the wind, it's exposed to sun and rain and all sorts. That's why there's a slight difference in the way it feels. Okay, they're doing different jobs, but you can see how the outer lip feel easily, naturally transforms into the inner lip feel. Exactly what is going on in the cervix. So like I said, the cervix is the neck of the womb. One part of that cervix is jutting into the vagina. That's the outer. So think about that bit as the outer lip. The other part of the cervix is closer to the inside. That's the part of the womb that will open up into the body of the womb. What is happening during erosion is simply that the cells, the inner lip is coming outside. It's moving away from and coming outside. So the cells of the inner layer or the inner lip moving outside and now existing along the outside. So imagine if you had to apply lipstick to tissue that feels like what your inner lip feels. That inner lip is more fragile, it's gentle, more likely to break or bleed. This is the problem that is going on with cervical erosion. So the first thing I want is please understand what an erosion means. It simply means, in fact, the new word, if I didn't say it, is a cervical ectropion. So you might hear of cervical ectropion. Now, I know that probably doesn't sound any better because even that is another big word that's like, what are they talking about? All it means is that where you would naturally find the outer lip tissue, you're now finding the inner lip. The tissues or the cells of the inner area, the inner layer, are growing and moving outside. So That is what is going on. Is it a big problem? Is it dangerous? Is it going to kill you? Calm down. Cervical erosion or cervical ectropion is not dangerous. It's a benign, harmless condition. It can cause troublesome symptoms though. It can make you panic and wonder what on earth is going on, okay? But it is not dangerous. It is not cancer. Doesn't mean you're going to develop cancer. So if you have the symptoms, and I'm going to talk about that in a moment, and you go to your doctor and they say, oh, you have cervical erosion, please don't panic, okay? Hopefully your doctor will be able to explain to you what is going on and then the next steps, okay? But for the purpose of our video and the lady who is asking us for help to deal with it, the first thing I will say to you is don't panic. I'm sending you right back to your doctor or your gynecologist or whoever to understand this condition better and then decide what is the next step for you. Okay, but for the purpose of our conversation here, we're trying to educate ourselves, okay? The thing about the erosion happening is that now what you have in the area of the cervix that normally should have the outer cell, the outer layer cells, you now have inner layer cells. The inner layer cells are the softer, more fragile. They have blood vessels. They have cells that are making fluid to support the function and the activity of the womb. But they're now stuck in the outer area. So that means they're more at risk, more liable to things like bleeding, leaking, lots of discharge, just because they're just quite sensitive, and that is where the problem happens. That is why one of the symptoms of cervical erosion is bleeding after or during sex, because now during sex, the friction is being applied to that part of the cervix where normally you have the slightly tougher outer cells, but they've gone, they've been replaced by the inner layer, okay? And so that inner layer is very sensitive. Any little thing is going to bleed. So of course there'll be bleeding after sex or during sex. There may be other things like because those tissues or those cells are meant to produce fluid, or they contain glands, just special cells that are meant to produce substances to help the body do its job. So because it's doing that, you might experience more of a discharge. You might, why is this happening? You might think, have I got an infection? What's changing? What's going on? All that can be very, very upsetting. And I know this is where this concern is coming from. And mind you, it's not only bleeding after sex. Some ladies may also experience bleeding in between their periods because they have an erosion. So it's enough actually to cause alarm, because in a day and age where we encourage you to come and see the doctor, to make sure you have your cervical screening, to come and see your doctor if you have symptoms like bleeding after sex, bleeding in between your periods, very, very important that you do, because those symptoms can also happen in cervical cancer. But cervical erosion, that is cervical ectropion, is not the same as cervical cancer. It's just important that you see your doctor to make sure that this is what you're dealing with and not something else that is more dangerous, okay? Did I also mention that there are some women who could have cervical erosion and they don't have any symptoms? Now, I know you are listening to me and you're thinking, okay, but why do women have this? Where does it come from? And I think that's an excellent question. Why do I think it's an excellent question? Before I get into that, make sure you give this video a like. Come on, guys, please. Giving you valuable information. I know that you're interested. Give the video a like. Come on. It doesn't cost anything. So some women could develop a cervical erosion. It's very common in pregnancy. Yes. And you might have clocked that it might have something to do with hormones. So we're not sure 100% why it happens and in particular cases or to some particular individuals. But we think it has something to do with hormones. So some women, where they're pregnant, are more likely to have a cervical erosion. We've also noticed that it happens in women using the birth control pill. The combined pill it can happen more often in them. And in some women, we don't know. It just happens. I may not be 100% sure, because it's been a long while since I actually looked into this. Meanwhile, if you're interested, I've got a video on this topic. I think it's probably a year old. I was doing a 2-part video looking at conditions that affect the cervix. So go and search the channel if you want a deeper dive into this. But the point I'm trying to make is that for some women, it is a natural variant. Okay, so again, just to underscore the fact that you don't have just to underscore the fact that you don't need to worry or be concerned about anything in the sense that, oh, this is going to cause cancer, this is going to cause a problem. I'm just a bit distracted because something just popped up on my screen that I don't understand and then it's vanished. I don't know if somebody was just being naughty, but naughtiness, it's you, you know. I expect maturity, but if you want to be naughty, then maybe you haven't grown up to that stage. So going on to the question that we're asked is, what help me to deal with cervical erosion? So of course, go and see your doctor. That's my first tip. Go and see your doctor. The second thing is, again, like many conditions, it depends on how distressing this is. Is it causing any problems? Because for some ladies, they don't have any symptoms. And it is something that is detected when you're having your cervical smear. It's something that the person, the clinician taking your smear might just observe, I can see that there's an erosion. And you might think, what does that mean? What does that mean? Don't panic. I've explained what it is and how it happens, why it happens. Please don't panic, okay? So what I'm trying to say is that if it's not giving you any problem, then we wouldn't treat it. But if you're somebody who has been experiencing problems as a result, it may be bleeding in between your periods or bleeding after sex, and you've done all the tests, they've examined you and they can't find anything apart from a cervical erosion, then there can be a conversation about treatment. Remember, I said that some ladies may have it because of the pill, so it might be worthwhile stopping that particular method of birth control and swapping to something else to see if that will be the answer. For some, it may be nothing to do with the pill. They may have this and they're having troublesome symptoms. There's a procedure where your doctor, the specialist, the gynecologist can use heat to then burn around. I know when I say burn, it sounds drastic, but it's not at all. It's something you'll be given enough pain relief. It's not going to be a high intensity heat, but just enough to denature that area that is growing the inner layer cells so that they stop growing, and it gives a chance for the outer layer cells to grow where they need to grow. That's the intention of that procedure. So there are things that can be done. It just depends on, do you have symptoms and are they distressing? And that is a conversation that you need to have with your doctor to decide if you need to be referred for that particular for this particular condition and to have some treatment. So there you go. This is what to do with, this is how to deal with the cervical erosion. Please don't panic. Your crying emoji really stopped me. I was like, oh my goodness, you don't have to be so worried. And I'm going to post the link to this video for the lady who asked the question. I really wish you all the very best, and I hope you see it and you watch this video and it encourages you. Go back and have a chat with your doctor. It definitely can be treated, and I'm sure you'll be doing just fine once you have that conversation. Thank you so much, guys, for watching. Don't forget to give this video a like, especially if you're watching on the replay. And of course, if you've got questions along the subject, by all means, let me know and I'll be sure to answer them. Thank you so much. I'll see you again soon. Bye-bye, guys.